What have they just taught that next generation of physicians? They've just taught them that you had better be quiet, you had better not speak out, you had better not question the safety of anything, even to your own government, even on your own private time, because you will lose your career. We will come after you and you will lose your career. I'm here because I'm really alarmed at the state of our loss of freedom. We have completely lost freedom globally, especially in the healthcare world, which is where I work. I'm alarmed by what I'm seeing. I realize most people are thinking, you know, COVID's over. Why are we even talking about this anymore? We're talking about it because the loss of free speech and the issues related to COVID are still present in the healthcare system, and we need to fix this. I practiced pediatric medicine for over 25 years. I trained at a top US medical school, did fine with all of my exams, and I was never what would be called anti-vaccine. I've always trusted my regulatory agencies and generally followed and recommended what they were recommending. Now, that doesn't mean I didn't have questions along the way, because I certainly did, but I was not anti-vax. Then the COVID shots rolled out, and this was so obvious to anyone caring for children. Our children, thankfully, were spared from the COVID virus itself. They had less than a statistical zero risk of a fatality from COVID. And yet they were being asked to take or to be injected with an untested COVID-19 shot that wasn't really a vaccine. They changed the definition. It was a synthetic genetic shot with unknown long-term safety issues and with clear short-term problems, right? Including fatalities. And that was just absolutely glossed over in the healthcare world. So we were told clearly to stay safe and effective about these products. Now, I was watching the research, I was watching the debates about this in the kind of high levels where they were deciding if they should recommend this product for kids, and they clearly didn't have the data. And if you watch the September 2021 hearing where they talked about giving this to children, they admitted as much. They said, we don't have the data, but we're going to roll it out there and see what happens.
And we need to understand if there's any safety data related to the doses that were given. There's a lot of data being followed on vaccine status and then cases and hospitalizations. And I think it's very important for us to understand those data.
I think that's a question maybe for the FDA, since it's from their briefing document. I see Dawn Fink coming up.
Hi. As far as I'm aware, we don't have safety data for those individuals. Those were numbers that we obtained from CDC. If there are CDC staff who are on the line who might have information about safety data, they're welcome to comment.
We don't have any evidence of adverse events being reported in that age group in particular, and as well as no data on outcomes at this time. We'll look at our data a little bit more closely over the next week.
We're never going to learn about how safe the vaccine is unless we start giving it. That's just the way it goes. That's how we found out about rare complications of other vaccines like the rotavirus vaccine. And I do think that we are going to, I do think we should vote to approve it.
So I need to be very careful with this. I never recommended the COVID shot for any of my patients. I never ordered it for any of my patients. But despite being careful with it myself, I began to see issues that I thought were related to the COVID shots in my community. As a practicing physician, you get a feel of what is normal, and you know how much, heart inflammation or myocarditis is usually around. It happened even before the shots, but we saw a significant increase in it, in myocarditis after the rollout of the vaccines, among other things. So I began to speak out. I was concerned that we were giving this product to children needlessly when we knew they didn't have any significant risk from the infection itself in terms of fatalities, but we were giving them a product that could potentially kill them. So why were we doing this? Why were we putting our children at risk? So I questioned that. I decided to fly. I was actually invited at the request of a sitting US Senator to fly to Washington, DC, and to provide some testimony at a fact-finding hearing related to the COVID shots. And so I did. I was very careful. I issued a press release stating that I was not speaking on behalf of any employer. And I spoke at the hearing. I shared what I called my anecdotal testimony. I said, I'm seeing an increase in myocarditis in my nation. I'm concerned that this project is being recommended for children. I showed a package insert of the mRNA package insert product that I had pulled from an mRNA box. I was not intending to give it to a child. That was not why I pulled it, but I had access to it in one of my clinics, and I wanted to see what it said. So I pulled it out of a box of mRNA product, and the package insert was massive. I unfolded it, and it said intentionally blank on it. So how did anyone injecting this into anybody know what was even in the vial? Now, it had something that looked like a QR code on it as well, and I, of course, took a picture of that. It referred me to a web page that said unknown product. So again, it didn't help me. So no one really could know what was in the vial. And I said, we're being censored and silenced. How is this happening that we're not having discussions about whether our children should receive the COVID-19 shot? Again, this was in December of 2022. As a result of that testimony at the U.S. Senate hearing, my medical school employer, which was Washington State University, launched an investigation against me. They were very upset that I'd spoken at that hearing. They specifically questioned the content of what I'd had to say, the questions that I had asked, and never got back to me with the results of the investigation. And a few months later, they terminated my employment with them by not renewing my annual faculty contract. Of course, that's not great. I enjoy teaching. I was a professor of medicine for my whole career. I lost my pension, I lost my salary by doing that. But a week and a half after they terminated my employment, they took it one step further. They actually reported the content of what I'd said at that Senate hearing, my questioning the COVID shots for children. They actually reported me to the Medical Licensing Board of Washington State to investigate my medical license. Yeah. So this has become absolutely crazy. We have lost our freedom to question the safety and the dangers of products. We have lost the checks and balances that should be present in any kind of a new rollout. And even more frightening, look at who came after me for speaking at a Senate hearing. It was a medical school. What have they just taught that next generation of physicians? They've just taught them that you had better be quiet, you had better not speak out, you had better not question the safety of anything, even to your own government, even on your own private time, because you will lose your career. We will come after you and you will lose your career. And that is absolutely frightening. So the implications that all of this has on the world of medical education is huge. The schools openly say that they support freedom of speech, but they do the opposite. They don't allow it. And we are in a lot of trouble if we have a world of medicine and science that is no longer based on open and free discussion and debate, on analyzing data, on really having respectful conversations back and forth with one another. We've completely lost the world of healthcare and science if we continue down this path. So it's interesting, actually many medical schools now no longer have their graduates recite the Hippocratic Oath when they graduate. Yeah. This particular medical school that came after me in their graduation ceremony in 2023, which I attended as a faculty member, I was still on staff at that point as a faculty member, did not have the students recite a Hippocratic Oath. They had them recite some other, some other paragraphs that stated they would be respectful and have respectful debate and dialogue with one another. That's not what happened, right? That's not what's happening. When you restrict someone's free speech, you've actually shut off science, you've shut off medicine, and we will not recover from this as a world if we continue down this path. But let's talk about the Hippocratic Oath for a minute. It's to do no harm, right? So our number one issue with any medical product should always be to ask, does this patient need this product injected into them? And if so, what are the risks of giving this product to them? Because the risks of giving a patient a product should never exceed the benefit, right? The risk should never be more than the theoretical benefit of giving them a product. And so we've lost our basic pillars of medicine and healthcare. We've lost patient autonomy by doing things like this. We've lost the ability to have informed consent discussions with patients. And we have to bring ethics back to healthcare. I think that we are to the point with education that we have to realize that this is not sustainable for the future moving forward. We cannot sustain this. We cannot have environments where our students are restricted to just one indoctrination pathway, where they're not able to have robust discussion and debate with one another. And the only solution that I have, which I think is a valid one, is to clean house. The faculty in these schools and the administrators in these schools have become way too far, have gone way too far in the wrong direction, and they need to be removed. I really believe that they all need to be cleaned out, just like you see happening at the highest levels of our regulatory agencies with all the changes right now and what people would call turmoil at CDC and FDA. It's necessary to clean house. We need to remove anyone who was in a decision-making position during this time period, and we need to rehire people back with interviews and with close assessments of what they did or what they did not do during this time. And we need to start fresh, because moving in the wrong direction, whether it's left or right, too far, is wrong. It's too far. We need to stay very neutral and balanced as much as we possibly can, and we clearly are not neutral and balanced at this point. We have absolutely shifted into an area that cannot continue if we want to see any sort of success with our healthcare and with our society as a whole. Events like this are very important because I think a lot of what is happening in the healthcare world is hidden from the basic public view. People understand that something is really flawed and wrong with our healthcare system, but they don't understand the extent of it. They're still picturing a world like we used to have, 15, 20 years ago. When I trained, we had robust discussions with one another. And that world is gone right now, from not just from our medical schools, but it's gone from our colleges, it's gone from our law schools, it's gone from any type of education that I can actually name, all the way from kindergarten up. So we need to expose this so that people understand the danger that we're in, and we can all work together to figure out a way to fix it. I want citizens listening to this to realize that you have power. You have power with your voices. You need to voice your concerns. Watching physicians, watching professors, watching just your everyday citizen be censored and silenced on different platforms, being censored and silenced by schools, being removed from teaching positions for simply expressing really logical and sensible thoughts and asking for open debate is wrong. We all can see that it's wrong. I think the majority of you can see how wrong this is. And you tend to have a tendency, I think we all do, of thinking, I can't do anything about this. Bummer that it's happening, but I can't do anything about this. Well, let me tell you, you can. You can use your voices, you can be loud, you can write letters, you can tell your neighbors, you can make some noise. We all have different spaces in which we work, but I am tired of hearing from people this idea that, well, I know it's wrong, but I was just doing my job. If you're just doing your job and you're taking part in something like this, then I would ask you to think about your job. Is your job really worth more than the future for your children and grandchildren? Please, speak out. Don't be silent. Make a lot of noise. Be loud. Use your voice while you still can. I also have a call out to all the physicians that have seen what's happened during the last 5 years. And I know we're all tired of hearing about COVID. This is not about COVID. This is about our ability to take good care of our patients by following, which for many of us was the Hippocratic Oath to do no harm. If you saw what happened during COVID and you saw how medical freedom was lost, how patient autonomy was lost, how informed consent went out the window, how all these things are so wrong, you really need to start speaking up and joining us. I know many of my colleagues have seen this. I know because you've come to me and you've said that you've seen this, and I know you're waking up to this. But here's the problem for everybody. It's really easy to sit there on Sunday and say, I'm going to say something tomorrow. At some point, tomorrow will never come, and it will be too late to speak out. That's how these systems work. They work because they put a cage down over all of us, and at some point, we won't be able to speak at all. So please, don't wait until tomorrow. Say something to a colleague, say something to other staff at your work. Let's get the conversation rolling that this is not okay. It's never okay to silence people. And let's stop this madness, because stopping this madness is all in our control and we can do it.